So we're going to be making the dorsal thumb splint that it's hand-based, and what we are trying to accomplish is support of the CMC joint and the MP joint of the thumb. So you might use this with a collateral ligament injury to the thumb, like a skier's thumb, but the most common use that I use it for is with CMC joint osteoarthritis. They recently did a study whether or not you should or have an advantage of including the MP joint of the thumb versus just the CMC, and it showed that both are helpful. In my personal experience, I find that patients, when they have advanced OA, a lot of pain, kind of thinking about surgery, and especially if they have subluxation of that CMC joint, that it does help to extend it up and include the MP joint of the thumb. So the pattern looks like this. So I'm going to just trace around this here. And this pattern is in your book too. This is warm enough now. This material that I'm using right now is a it's 3/32 or 12th inch mano splint, and it's their Wisconsin material. Again, mano splint has been around for about, so it must be going on about 2 years now. And I've been using their materials for about 6 months. And I think they have some pretty nice working characteristics. This is the one that they print the pattern. So I don't know, yeah, I wasn't really paying attention left, right. So this one is gonna go on your left hand. Mm-hmm. So with a hand-based splint, you don't necessarily need to use the wrap, because you should be able to form it. Did I say left? I meant right. Dyslexic. Okay, so I'm going to place this dorsally. Okay. And then I'm going to wrap this, and you give it a little tug to get this to go between the thumb and index finger. So it's going to kind of wrap around. I don't want to seal that shut. I'm just going to lay it across there. But I want it, I want it to be secure around the proximal phalanx of the thumb. So I want that nice and close fit. I'm going to palmar abduct the thumb a little bit to make sure that she's going to be able to oppose to the tip of the index finger at least. Okay, relax now, but I don't want her to pinch while I'm forming. So the other thing that we talked about is the little gapping between the skin and the splint material that happens right down here at the base of the thumb. So I'm going to just pinch that material together to get a nice close fit. And then once I get that nice and close, I'm going to fold that off to the side. And then I'm just going to hold her hand in that position until everything hardens. And I think one of the things that a lot of people do is they try to start rolling edges, while they're at this stage, but then you can mess up your fit. And so if you just really let it harden, you can go back and roll those things and trim things away later. So I want to make sure that her IP joint can flex all the way down, which it right now it can't. So I'm just marking with a grease pencil where I'm gonna trim and roll the thumb. This looks good. There's a little bit too much length here, so I will trim this off and trim it kind of right at the wrist. And then I'm also gonna roll that proximal edge as well as the distal edge to increase the area of force application and make the splint more comfortable. So trimming here. And then I had a little trimming to do on the thumb to allow her IP to flex. So I'm gonna, that little dart is kind of sticking out a bit. So I'm gonna use the heat gun to flatten that down. So just pressing that down now. One thing disadvantage about the material that's printed is when you heat it with the heat gun, of course it messes up the design, so it can kind of look a little bit messy. Then I'm gonna dip the proximal edge and real carefully watch so you're not heating too much. And when you roll that proximal edge, instead of pinching like this, if you take the flat of your hand and roll like that, you're going to get a more smooth edge. Okay, and then the distal end, so the MPs have a soft surface. And I would roll this edge of the thumb as well. So just check the fit. So that's looking pretty good. Now, remember that strap? I punch 5 holes in a row and then come down into the palm with that strap. So I'm going to go ahead and do that. When you punch these holes, you kind of want to overlap them a little bit so that you can press your strap through there. And then again, remember when you put your straps on, you really should heat them on the heat gun so they stick, but I'm just going to go ahead and not do that right now just to save time. So I put one on this border that's going to take 2 straps, one from here and one from here. And then I'm going to put a strap on the tab of the thumb and on the splint so that I can secure the thumb opening without locking in the thumb. One more strap here. So then I'm going to run Velcro from here, down to there. From here to here, and I'm gonna poke it through those holes in a minute here. And then one around the thumb again. Make that one a little bit narrower. Just cut my off with some good scissors. Okay. So this strap you're going to press up through those holes that you punched. Sometimes if you grab it, you can use the needle nose pliers to pull it through. Looks like my overlap didn't go through all the way. Okay, so go ahead and put that on. Strap, now crisscross those straps because that is going to be more secure. How does that feel? Okay. And can you touch your thumb to your index finger? Yeah, so it's going to give her function. So the only other thing that I do with this, go ahead and take it off one time. Is because of the back of the hand is pretty bony. I usually do kind of pad the inside of this one. So I've got my fleecy web. Did I do that right? No, I didn't. I did it backwards. I think I can still do it. Right? Sure.
Yeah.
The other way. But that's okay. It's not going to really fit quite right, but don't want to waste it. So then this is kind of tricky. I usually have my patient sit there and hold that for me until I get this lined up inside. And you can see I'm a little shy on that end, but then I just kind of wrap that around. And that you can see how nicely that contours. More than I need there. But that makes it really comfortable. Okay, a little shy there. And then the other thing that I might do is take another little piece of the fleecy web and pad either the front edge of the thumb or the back edge of the thumb or both, depending upon how sensitive that patient is. So there's over the back. The only thing is when you put it on the thumb opening, they have to be kind of careful going in and out that they don't, curl up that padding. So go ahead and put that on. So that is going to attach on the top of this side piece of Velcro, and then this is crisscrossing and attaching on the bottom. And that's wrapping around the thumb. And I've had patients, who were in a lot of pain, basically to the point that they were, going to have surgery soon. Use this for up to a year or more, and avoid having surgery, or even avoid surgery altogether if they use it consistently. So it really is very helpful.